We feel good. We're going to get started. Thanks everyone for joining us this afternoon. We have representatives from county government throughout the region, and I'll be passing off to them in just a minute. Of course, I'm Mark Molinaro, Dutchess County's executive. We, as a region, have been certainly working together for, well, nearly 11 months now, both preparing for the onset of this pandemic, responding to it, and attempting to assist in containing it and ultimately providing for public health and saving lives. We all know this. 1,900 public health departments across America are administered by county governments, and county governments are on the front line of response. As we worked together to respond to the first wave, if you will, of COVID-19 cases, we saw far too many get sick, far too many families torn apart, and certainly far too many lives lost. We're here this afternoon together to really remind our residents as we see the crest of the second wave really coming into the Hudson Valley, almost west to east. You can almost feel it occurring in that way. We're reminding residents that we just cannot give an inch, and that by becoming more either fatigued or casual about this pandemic, we are seeing broader transmission of the disease, and we really want to double down in these moments. This is a critical juncture in this region today. We're seeing such a growth in new cases, and of course, growth in the positivity rates in every one of our counties, and we definitely together want to remind residents that we really do need to hunker down and not give an inch. So as we enter into the holidays with Thanksgiving, of course, a week from now, compounding, of course, activity following Thanksgiving is Hanukkah. Hanukkah followed by Christmas, followed by New Year's. We really want residents to remember that there are steps we can take to protect your own health and the health of our loved ones. And of course, that remains those basic things that we've talked about. Physical distancing, keeping it small gatherings, personal hygiene, and wearing a mask. As we go into the Thanksgiving holiday, as a region and as communities together, we really want to encourage residents to keep it small and keep it simple. If you're not feeling well, this isn't the time to go out to work or to go off to school or to go to a family gathering. If you feel as if you may have contracted the disease, this is not the time to risk your health or the health of others. And of course, just by being casual, not taking those mitigation steps in your own home and in your own family, you do run the risk of getting sick or getting someone else sick. And so together, we want to remind residents how important it is that we work together to mitigate, to use those mitigation steps to prevent the spread of the disease. So rather than me going on at length, what I'd like to do is ask Dr. Neil Wythian, who's the commissioner of the Department of Behavioral and Community Health here in Dutchess County, an infectious disease doctor himself, to offer some comments, and then we're going to move to County Executive Steve Newhouse in Orange County. Neil?
Thank you, Mark, for that introduction. As Mark mentioned, the rates of COVID positivity are rising, and what we're seeing during our investigations is the fact that, it is not clusters or large facility-driven outbreaks that are driving the numbers, but it's the casual exposures, it's the exposures at home and other activities that are driving our numbers. And when our disease investigators are interviewing individuals, we're finding this to be the fact. And we want to caution individuals that, again, what we're seeing now is a reflection of what activities and interactions that have occurred 2-3 weeks earlier. And the same goes with what's happening with hospitalizations and ICU beds. We are just at the beginning of this second wave, if you could call it. And I would caution people that, again, in this fight against COVID, it's not sprints, it's a marathon. And when we sort of let down our guard, especially in terms of these mitigation steps that Mark highlighted, oh, I know this individual, this is a family member, I'm not going to take these precautions. That's when we inadvertently give opportunity for this virus to continue to transmit and get a foothold in our homes and our places of business and so on. So again, I want to commend New Yorkers and our community for all the hard work that they put into driving our numbers down during the spring and summer. Now is not the time to get complacent, and now is the time to steel ourselves and to be diligent in the steps that we're taking. Thank you.
Thank you,
So,
Doctor.
Hey, Steve, let me just remind reporters if they have questions, we'll take them at the end. They can raise their hand. Now, go ahead, County Executive Steve Newhouse.
Thank you, Mark, and thank you, Doctor. And it's great to be here with everybody. You know, Pat Ryan, Mary Ellen Odell, and Mark Molinaro and I, we've been doing this for 9 months, every day of the week, at least 5 days a week. We're on the phone every day. And we're getting a synopsis of where we all are as a region, where we are individually. And I have to tell you, not only have we grown together and we've worked off each other, and as well as the health commissioners, but we've been able to really strengthen each other, share best practices, some mistakes that were made here or there, and move forward. Unfortunately, we are seeing an increased number, in particular in my county right now. In the next 24 hours, I am anticipating 4 yellow zones being established: City of Newburgh, City of Middletown, Town of New Windsor, and Highland Falls. As the doctor and Mark mentioned, a lot of these numbers are avoidable. We are attributing them to gatherings in Pine Bush, for instance. We have 20 people that have tested positive from a house party, another 40 or 50 awaiting results. So the message that we'd like to send out is, look, we all know that we're heading into this second wave, whatever you want to call it, but a lot of this stuff is avoidable if you take these precautions. Most of us, if not all of us on this call, your leaders who are out and about, have not gotten sick. I'm out and about on events all day long. I wear a mask. I wash my hands. I did ribbon cuttings. I was at a food pantry this morning, and that's part of our schedule on a regular basis. So you don't need to go completely underground and avoid the world, but if you take these basic precautions, you can protect yourself, your families, and everybody else you interact with. And I'll say one last thing before I hand it over to Dr. Gelman. I've had a number of deaths in the last 2 weeks. At least 2 of those deaths were people in their 20s. So when we see a lot of people that think, if I'm not a senior citizen, I'm going to get through this, that's not the right mentality to have, because not only are you putting yourself at risk, but you're also putting elderly people and maybe other people that are younger at risk as well. So this could impact everybody. It impacts everybody differently. Whether you have a pre-existing condition or not, you don't want to get this virus. So the quicker we all work together, the quicker we're going to be out of this. And I'll turn it over to Dr. Gelman.
Thank you, County Executive Newhouse. Good afternoon, everyone. To echo a lot of what has been said already, unfortunately for the second wave this time around, the COVID-19 infection pandemic will be concurrent with the flu season. And I'd like to just emphasize briefly the need for really getting your flu shot and ensuring that we're preserving our capacity and continuity of operations and resources as we're seeing this surge in new COVID-19 numbers and the resulting complications. I know there's a lot of misinformation out there as far as flu versus COVID-19, and a lot of it centers around the recovery rate being upwards of 90% and so on and so forth. In terms of statistics, locally, statewide, nationally, globally, 80% of individuals, as we know, present as asymptomatic or mildly symptomatic, and they will undoubtedly recover with treatment or not. However, 14% will develop complications, or those will result in hospitalizations, and about 3 to 4% will result in mortality, meaning death. So I think that's a very important statistic when we're comparing COVID-19 to the flu, where with the flu, as we all know, in the US annually, you have on average about 50 million annual cases of the flu in any given season. Of those cases, and those cases are spanning about that 6 months period of time for flu season, only 0.01% result in complications and hospitalizations. So that's about 500,000 out of those 50 million people. And again, keeping in mind that it's over that 6 months period of time, and about 0.001% result in mortality or death. So we have a larger number over a longer period of time, and clearly a much lower hospitalization and complication rate that what we are seeing with COVID. Also, as far as that timeline is concerned, it's very important to emphasize the fact that flu season, we have a number of months. With COVID-19, we tend to get hit with this tidal wave of cases and really burdening our capacity and resources, whether that's local, statewide, or national. And those resources are really the rate limiting factor in response capacity, because when we receive that increased number of cases over that 8 to 10 week period of time, it severely limits our first responder capacity. We're of course limited by the number of hospital beds, both general and ICU, nursing home capacity, morgue, funeral directors. And as far as resources, just sheerly staffing, continuity of operations, PPE, testing, medical supplies. So those are issues that impact us community-wide. With that said, I have to mention that traditionally it's what you bring to the table that matters, but this holiday season, it's all about what you don't bring. So as we all came up with this collective slogan, don't bring COVID-19 to the Thanksgiving dinner table, please don't. We are seeing a surge in new cases in the aftermath of Halloween parties, at least in Orange County. We have seen over 1,000 cases over the last 10 days, many of them attributable directly to social gatherings and a direct result of parties. I have submitted a number of communicable disease investigations that have uncovered these clusters that have resulted with departmental, whether municipal or county department closures, that have resulted in closures for schools, that have directly resulted in hospitalizations and even deaths. So it's very important to emphasize the need to really be vigilant right now. We're not saying don't celebrate, but just celebrate cautiously and with your household members. Communicable disease investigations have uncovered a common thread that has been mentioned, and that is this general disregard for safety precautions, whether intentional or not. I think we're all fatigued with the lockdowns. We're all fatigued with the sheer duration of this. This has been a Herculean effort by both the public, as well as public health professional, medical first responders, and everyone in between. And it most certainly, as Dr. Vadian has mentioned, is a marathon. But by the same token, the same prevention and safety measures we have all heard ad nauseum about. We've mentioned them already, and we can at this point recite them by heart. But just the failure to wear masks, not wearing them, not storing them properly, not cleaning them properly. So you can wear a mask to get into a store, but if it's soiled, obviously it's not doing much good, or if it's under your nose, you're not really protecting yourself or others, especially in the company of friends, relatives, and acquaintances. I think we tend to generally let our guard down around our loved ones, and we tend to be in more intimate and in more proximal contact than we tend to be otherwise. Not socially distancing, attending and hosting these social gatherings, and generally leaving your household while symptomatic. Many communicable disease interviews were conducted recently for our case volume, and most individuals surprisingly reported mild to moderate symptoms. So we're not seeing this widespread of asymptomatic, as we colloquially refer to it, transmission. And it's more these vague, very broad symptoms that may be attributable to an allergy or just a seasonal flu, or just being under the weather. So I have a headache, I have a very mild symptom, I may have a runny nose. So rather than staying home with that postnasal drip, or these kind of vague symptoms, unfortunately, have resulted in individuals leaving their household, presenting into these congregate settings and environments such as schools, work, a lot of athletic trainings, a lot of sports events, and that's where we're seeing most of the transmission. And one final note that I'd like to mention, not to be verbose, but unfortunately the reason why COVID-19 has been so successful in its propagation is because, unlike SARS, where an individual becomes more contagious, essentially has a higher burden of viral particle as the disease progresses. Unlike SARS, COVID-19 is most virulent and most contagious in its early stages. So as soon as you have incubated this virus, and prior to you even being overtly symptomatic, you are at your most contagious. So that is really the premise and the need for wearing the mask, social distancing at all times, because at that point, you really want to avoid contracting and transmitting the virus because before you are acutely aware of being ill at all. So going to work, going to school, going to athletic training, sporting events, going to social gatherings, such as the upcoming holiday celebrations, is of the utmost concern because they will undoubtedly further increase transmission of this illness. Having people congregate in small, poorly ventilated indoor spaces for extended periods of time should be avoided during the coronavirus pandemic, especially as COVID-19 cases rise across our region. And one kind of last final note, the flu can most certainly be concurrent with COVID-19, so you may possibly have flu concurrently with COVID-19 infection, which obviously will exacerbate symptoms and outcomes. So we truly urge you to get your flu vaccine. Thank you.
Thank you, Dr. Gelman. And just as a reference, even a reference point here in Dutchess County, only 2 weeks ago, we were monitoring 192 active cases. Today, we're monitoring 609. 2 weeks ago, 10 individuals hospitalized in Dutchess County. Today, 37. At this pace, we will exceed 1,000 active cases by this time next week. To offer some additional comments, our friends for me to the south from Putnam County. Gentlemen, go right ahead. I think it's Tom and Dr. Neshuat, but you're at the other end of the table, so.
Thank you, County Executive, and warmest regards from County Odell. Hard act to follow. Pretty much everything's been said. We'll just give you a little perspective from our county. What we've seen is a direct correlation from letting down our guard from Halloween. We were, as a county, 4 months prior, very stagnant below the 2-point threshold, and directly from October 31st to 6 days later, we doubled. You know, we immediately doubled after 6 days. So we see what we've seen, and that wasn't through businesses, that wasn't through the schools, that was primarily through family gatherings and parties. And unfortunately, I think, like you may have said earlier, you know, part of that was letting our guard down. Part was definitely fatigue, and you know, it didn't help that Halloween was on a Saturday. The weather was beautiful, and people were around people way too long for too long extended period of time in a social setting. The one thing we have seen is we were kind of lucky enough to stay away from micro clusters, so we didn't get alarms like other counties may have gotten during that period of time. But what we have seen and we do see is the businesses, the schools, they've all been doing a phenomenal job in keeping their places safe. In fact, I listened this morning, New York City schools had closed. Now their infection rate inside the school is 0.23. You know, so it just think about that. Like, the safest place for kids to be is actually in the school. You know, and that's something that we're looking to not have to shut down areas. We'd rather see kids get 8 to 10 hours of a safe schooling environment, maybe an after-school activity that's safe regionally, than shutting them down. Rather than shutting down full businesses, we'd like to, you know, we can deal with condensed hours. It may not make as much sense in the gym environment because, you know, you condense the hours, condensing the population in the gym. But regardless, we'd like to see the businesses stay open. We'd like to also, you know, the Department of Health around the state has been phenomenal. We work daily, we work with the schools daily, the business industries. They've really done a phenomenal job of trying to keep people safe. We think the message really should go back to the families. Take responsibility for your kids, your household, and do a little bit in each of those places. Through the holidays, make the gathering smaller, keep it to a limited number of people, and again, keep the elder population safe. Keep them away from that. That's not enough for people to make some habit changes. Then I really don't know what is. But as far as the businesses and like I said, the schools, the Department of Health, all the information is there. the one other thing we look at in Putnam is our numbers are high right now. For us, it spiked up in 2 weeks. But we can't even, it's very hard for our public to go out and get a free test. You have to be symptomatic to get a test. So what I'm saying is, we're not looking at the whole 100,000 population. We're looking at the symptomatic people who went for a test because they felt ill. So it's for us to look at the number as it is really, it's not indicative of exactly the full population. It's indicative of the sick population. So again, people still have to realize that this is serious. Small groups, family groups, stay away from big parties, and hopefully the vaccine comes out and we get on the other side of this. And with that, I'll introduce Dr. Mike Neshwat. He's chair for the Department of Health.
Thank you, Tom, and thank you, County Executive Molinaro. I also want to say, like my colleagues in Dutchess County, Orange County, Ulster County, and other counties, we also struggle with the same challenges. And yes, social gathering is the major driver of our uptick in COVID-19. But in Putnam County, my biggest challenge right now are the travel sports teams, which has been a significant uptick in Putnam County because we do neighbor other states, and a lot of these teams are traveling to outside states, and we have no control of that. But obviously, working with our resources, our town officials, with the county and communication, we were able to discontinue the traveling sports team, and they are following the guidelines, and I'm expecting that our numbers will start to decline. But unfortunately, the other challenge and my concern for the region is our college students that are going to come home to their loved ones for Thanksgiving, for the holidays in December, for the new year. And, I got to tell you, the take-home message is this: we should not be social gathering. We need to obey the rules, and that is, social distancing, washing your hands, wearing a mask above the nose and over the mouth. And, if there are signs and symptoms of shortness of breath, coughing, fever, loss of taste, loss of smell, to please they have to contact their doctors for further evaluation. We love our families, we love our neighbors and our friends, but we have to be smart and we have to be safe. And, like the other counties, this month has been our second highest month for COVID-19. And it is very concerning. And I think the take-home message is we just have to be smart. We have to work together and protect our loved ones. Thank you.
Thank you, gentlemen. And for closing comments among our group, Ulster County Executive Pat Ryan. Go ahead, Pat.
Hey, excuse me. Hey, good afternoon. And nice to see my colleagues on the screen here and see many great folks dialed in. Thanks for taking the time. We felt, I think collectively, it was really important for all of us to get on the line and really echo and reinforce this message, primarily driven by our health experts that we've all relied on and that have been right every single time at every single phase of this about where we're at and what's coming. We felt that we all needed to jointly say, this is a wake-up call moment. And the numbers and the data and the science are just crystal clear. And in fact, if you look at where we were in March and April at the worst of this, separating the emotion and the exhaustion and everything else, we're right back there right now, every single one of us at the same exact place. And it feels different mentally, psychologically, but in terms of what the virus is doing, it's exactly the same. And that should be real cause for concern. I know it is for me and for our team here. So most of the high points have been hit. I wanted to share one specific anecdote of echoing what others have said in terms of the main driver being social get-togethers or living room transmission, whatever you want to call it. We had one incident going back to the Halloween theme. We had an incident that actually crossed two of our counties where we had a Halloween party that involved just three families that decided to get together with their kids, about a little over 20 folks. Fast forward 3 weeks now. Initially, there were 4, we've learned through contact tracing, 4 children that were positive unknowingly at that gathering of those 3 families. We now have 15 of them have been positive. And the real exponential effect of that, though, is that that has now touched in our region one college where one of those individuals attends, and 3 different schools, an elementary, a middle, and a high school, all in one of our school districts, and has affected 2 counties. That's one incident. And you multiply that exponentially and you add the time dimension, and it's very clear how we are where we are now. And same numbers here. 2 weeks ago, we were at half the number of cases we are now. So in a 2-week period, because everyone let their guard down around Halloween in particular and got together, we're now we've now doubled our cases as well in Ulster County. So it doesn't make any of us happy to do this, but the message from me, and I think I speak on behalf of everyone, is let's get our head back in the game. We know what we need to do, and let's let the science and the health expertise really continue to guide us and rally us one more time until we can get to the other side of this, because we have a light at the end of the tunnel in the spring and the summer, but we have to get through that tunnel together and limit the impact. So I'll turn it over to our exceptional health commissioner, Dr. Smith, and I'll thank her and all of our health commissioners on this line. Man, I didn't expect that we'd be talking so much, Dr. Smith, in this year, but you're on my number one on my speed dial, as I'm sure is the same for my colleagues.
Thank you, Executive Brian. And yes, you are on my speed dial as well, as are my colleagues on this line. And I think just to try to wrap this up, because certainly everything that was said is absolutely true. And I think it's pretty obvious when you see and hear us that we're all very much in agreement on this virus. It is a virus. It has no political orientations. It doesn't know boundaries. It doesn't know geographic borders. It is spread from human to human contact. It is a respiratory virus. It has multiple effects, including death, and unfortunately, many of our loved ones. And the message is all the same. It's a science, it's a disease, it's part of a medical phenomenon right now. It is something that we can certainly help to prevent. Simple measures, the mask wearing, etc., social distancing, avoiding large gatherings, even family gatherings at this point outside of our households. We are seeing folks coming back into New York from Florida and where have you for the holidays. It is so important. And, again, if we're going to give each other a gift, let's give each other the gift of good health and not spread this virus, because our caution has been, subjected to now this COVID fatigue that we're all seeing. We have to kind of re-energize ourselves and say, we can get through this. We can take preventive measures. Hopefully there's a vaccine on the horizon that we're all talking about how we're going to prepare to distribute in our communities. But again, we're working together. County officials are working together. Public health officials are working together in trying to protect our respective communities. So again, the power is up to the individual as well to do what they can. And now is the time to certainly exercise those common good sense measures. Wear the mask. Don't let your guard down. Protect your family, protect your loved ones, protect your community. And with that, I guess I will hand it over to our host. Thank you very much.
Thank you, Dr. Smith. I want to remind members of the media on the call, if you have a question, we'll start taking them now. Just raise your hand. Someone from Dutchess County will let you into the queue. Dr. Smith, it was a nice way of ending. I know that we all have been saying sort of this very basic message. It's actually just be considerate of your health and the health of others. If you think about that first and not worry about the rhetoric, ideology, concern for beliefs, if you just take those steps first and really think about how I can protect my health and others, we can definitely weather the storm. And I think that's our message today. Questions from the media? No hands up?
We have Heather Yakin.
Go ahead, Heather.
Yes,
Go ahead, Heather.
Hi, for County Executive Ryan and County Executive Newhouse, I'm just wondering if the Halloween party you're referring to, is that the same party that you're referring to, the Pine Bush party?
Yeah.
Is that,
There were two actually that crossed our counties. One was in Pine Bush, another was in Walkville. And those are just examples. And I think, we're all trying to get the balance right of respecting everybody's privacy as we do this important work, and that's critical, but we're also trying to make this real for people, that those small decisions we're each making really do have major exponential downstream effects on the whole community.
And Dr. Gelman and I can get into this on this, but we don't need to. We had similar parties throughout the county that are attributing to our case numbers. Warwick was another big one. And I just got word that the governor will be announcing those yellow zones, I think, within the next hour.
I see Roger Hannigan Gilson.
Hi. Yeah, this is for any of the county execs. When people are traveling to, your counties from non-contiguous states, are you generally seeing them quarantine for 2 weeks, or them kind of flouting that?
Well, I mean, first, right, the instruction at the moment is to hunker down for 3 days, and then on the 4th day test. I will tell you, there are a good number of people who are earnest about that. However, we are pointing to cases that are travel oriented, if you will, that we have families who may have traveled not necessarily following the quarantine requirements, not necessarily testing, and of course spreading. But I will say, we do get questions often from individuals who are traveling out of the state back, or those who are traveling from out of state here, that are generally interested in trying to follow that 3-day quarantine, 4th day test. Pat or Steve?
We've had to take people. I mean, we've had to use court action in some cases because we've had people that would not quarantine. So it's a mixed bag. We hope most people do it. A lot of this depends on the honor system, but I think that there's more and more tracking going on, and we have people that are traveling a lot still. And unfortunately, we've had to take this to court. So we're seeing most people comply. And Dr. Gelman, I defer to you if you want to just make a quick comment on it, but we've had the extreme measures where we had to go to court, which is unfortunate for everybody.
Yeah, so as County Executive has mentioned, we have had to issue a number of both subpoenas and cease and desist orders. Quite a few of our clusters, the ones that did not result directly from social gatherings or parties, quite a few were travel related, especially early on during the second wave. That initial influx of cases during the secondary wave was predominantly travel related. Currently, we're seeing a bit less. However, we anticipate probably more travel related cases as the holiday season approaches rapidly. As the County Executive Newhouse has mentioned, please, the honor system still works. We're all in this together. It really is a matter. The future really depends on what we do right now, what we do today, and each and every one of us can do something, whether you're doing something by wearing a mask or not doing something by not socially gathering, and the travel related protocols really help following them.
Pat?
Executive Molinaro, can I just add something from Putnam County?
Yes, go ahead, please.
Dr. Meshwar, I just want to say that in Putnam County, we've received numerous inquiries of people that have traveled from restricted states back into New York, into Putnam County. And these calls have come in from either neighbors or employees. And what we've done is we've actually made follow-up calls, courtesy calls to these individuals, and to remind them that there is a 14-day quarantine. You can opt out of it if you tested 3 days before on the 4th day. And we've been, in a way, fortunate that people either are quarantined for the full 14 days with follow-up calls from the department, or they have done the test and they do present to us the 2 negative tests. So we've been fortunate in that regard, because I don't think, because we're a small county and it seems like everybody knows everyone, I think a lot of people really want to comply, but they don't want that black eye for their business, and they want to keep their neighbors safe. And that's the take-home message. be safe, be smart. We have loved ones, we have neighbors, we have friends, we have family, and just follow the rules. And sometimes we just have to remind people, and we can't say it enough, whether it's on social media, either way, we just have to remind people that's our job, to protect the population that we serve. Thank you.
Eddie Johnson.
Eddie has to unmute.
Hello? Yes, am I unmuted?
Yes, you are. Go right ahead.
Thank you. Edie Johnson from the Orange County Post. Question number one is to Steve Newhouse. I think it might be helpful if you could present us with your statistics to give the percentages on each municipality in addition to the number. You know, I'm in and out of Newburgh fairly frequently, and it seems so obvious that the larger the municipality, the more numbers there are going to be. But I also see people there trying very hard, almost everybody wearing masks, and I think it would just give another angle. And the second thing is, I don't hear a lot about from the health commissioners what maybe people could do to help keep their immune systems up. Unfortunately, most of the people that are interested in that already do it, and the ones that aren't are like, well, I'm going to get it. I'm going to get it. Yeah.
I'll answer mine first, Edie. I'm going to give that tonight to my daily address. We have to be careful. Like, so City of Newburgh right now has 120 or 137 active cases. I can give that because that's a large number, but I have other communities that have 2. So that's why I try to stick with percentages rather than numbers, because we got that, you know, personal identification information. But I'm going to go through it a little bit in depth today, just to show everybody that it's not just the city of Newburgh. It's not just the city of Middletown. And you have a lot of people throughout this process. Mark and Pat and I have been dealing with people like, if I avoid this area, I'm good to go, right? I can let my guard down. And that's obviously not the case. But I'll defer to any of the health commissioners, Mark, if they want to touch on how people can boost their immune system to try to make themselves prepared a little bit.
Let's share some time. We'll go to Dr. Wythe and then Dr. Smith, and we'll see if there are any other questions. Please raise your hand. We'll try to get you in. Go ahead, Anil.
I think nutrition, sleep, exercise, and the simple things that your physician tells you are the ways to boost immunity. You know, obviously, one way not to stress your immune system is not to be exposed. And so, again, the take-home point should be, again, the basic respiratory and personal hygiene and mask wearing cannot be stressed enough.
Go ahead,
I
Dr. Smith.
absolutely agree with my colleague. And also, you know, if you're sick with the flu, your immune system's going to be run down quite significantly, which may make you perhaps more vulnerable to acquiring other illnesses. So certainly having the vaccine for the flu, against the flu, is going to be important to have your system at its best, as it were, to deal with the other illnesses. But again, there's really no magic, I don't think, solution to boosting immunity other than prevention, which is, again, worth that pound of cure. And that's the best I can offer you, but it certainly get the flu vaccine as well.
Thank you, Dr. Smith. We have one more question. Roger.
Hello, this question is for Dr. Gelman, just about the flu season. Are there any kind of predictions in the Mid-Hudson Valley for how bad the flu season is going to be? I mean, I've heard both things, that it might be minor because of the precautions being taken about COVID and the lack of travel from the Southern Hemisphere, but I've also heard it might be worse because less people are getting the flu shot. So I was just wondering about that and whether you know if more or less people are getting immunized for the flu this season.
So thank you very much for that question. Of course, it's a bit early to say, only because flu data comes out as aggregate data, typically weekly or even monthly at this point. From what we are seeing, as you have mentioned, from Australia and reports in Asia, so areas of the globe that tend to have the flu season earlier than us, they seem to be having a milder flu season this year. Not necessarily to say that that is the ideal indicator, but thus far, the preliminary reports are showing that there is a milder overall flu season on other continents that tend to receive those cases first. I will say generally, at least for New York State, the flu vaccination is not ideal and not where we would want it to be. For individuals under the age of 55, we're at about 35% compliance with vaccination. And of course, individuals 55 and older tend to vaccinate at thankfully higher rates, so upwards of 50, even 60% during some seasons. Hopefully this year, with amplifying that message and the necessity for really getting your flu shot this year like no other, please, we urge you to get your flu shots. Anyone that can medically tolerate it should absolutely get your flu shot this year like no other, simply because you may absolutely, as Dr. Smith and both Dr. Vadian have mentioned, you can absolutely have the flu concurrently with COVID-19. Having one may make you more susceptible to complications of the other. First of all, contracting the other, and second of all, developing complications with both of those concurrent viruses. So this year, it is imperative for everyone who can medically tolerate it, get your flu shot.
Can I just say one other thing? If you look at the New York State Department of Health website as well, they offer every week an update on the flu and where it is. And right now it's in just about every county throughout the state, with maybe one or two exceptions as of a week ago, but it is out there. And certainly this message is an important one to pay attention to.
Thank you, Dr. Smith. Roger, did you have a follow-up? Hold on one second. We're trying to get you live, Roger.
There we go. Yeah, just a quick follow-up for Dr. Gelman. The 35% compliance rate you're seeing, is that for people under 55 or for the population as a whole?
That's typically for people under 55, and that's not indicative of this year's rates because clearly it's too early on in the season to tell where we are with compliance with vaccination this year. Those are just standard numbers that we have seen in years prior.
Thank you, Dr. Gelman. With we'll offer some brief closing remarks. We'll start with Ulster County Executive Pat Ryan.
Thanks, Mark. Thank you again to everybody. I know we've had a lot of bad news, you could say, or hard to hear news, difficult to hear news and numbers and statistics. And I know, I think we all feel it's important that everyone hears that. And serves as this wake-up call, but I also want to end by saying maybe a slightly more hopeful note, which is that we've been through this before, not too long ago, as a community and as a region, and we know what we need to do. We know so much more about the vaccine. We know how to treat, or excuse me, the virus. We know how to treat it better, and we know that all the precautions that we've called for, especially masks, hand washing, and distancing, work. So I hope that we can all use this moment and this narrowing window where we can still collectively say, we're going to put our guard back up, we're going to take this seriously, and we're going to get through the holidays and keep each other healthy and safe. I know we can do that. Please, please encourage your family and friends and loved ones to do the same thing, because the actions that each of us take individually absolutely have a ripple effect on everyone else. So please think about the collective when you're making those decisions, and thanks for joining us.
Thanks, Pat. I know that Mary Ellen Odell wanted to be with us today. Tom, do you want to offer a few remarks before we close?
Yeah, well, thank you for hosting, Mark, and also we'd like to thank all the essential workers who really have been busting their butts for the last 9 months and trying to keep us safe and getting the information out there, continue to get it out there, and we hope they stay safe. And also just to say happy Thanksgiving, everybody, and then Merry Christmas, Hanukkah, happy holidays. So thank you very much for hosting, Mark. Appreciate it.
Thank you, Tom. Steve Newhouse?
Yeah, again, we've had a great synergy in the Hudson Valley here, working very close together with the Association of Counties throughout the state. This kind of comes as a wave. So our upstate counties lean on Mark and Pat and Mary Ellen and I. What the heck is going on and what do we need to do to prepare it? So there is a very good, tight family here. One thing we didn't touch on that I just want to mention is the school districts are under extreme amount of pressure. And although this seems easy to some people, this is very complicated. When you shut down one school, you now have kids that their parents have to be home, including teachers from other school districts, including first responders. So although we're seeing New York City schools close down, Dr. Gelman and we're worried about, and I have other schools that announced they're closing in Orange County. So I just ask for everybody to be patient. Pat Ryan mentioned earlier, we all see the light at the end of this tunnel. When the vaccine comes in effect, all that stuff is going to improve things and make things come a little bit quicker. However, quicker is not tomorrow. We still have a number of months. We have a winter to go through. Mark Molinaro talked about the holiday seasons that are coming, Hanukkah, Christmas, New Year's rolling into that. So we just need to continue to work together, continue to be patient, continue to care for each other. I went to a thing today where the restaurants who are reeling right now had a number of food donations today, so people have Thanksgiving. So every one of us, Mark, Mary Ellen, Pat, myself, all our health commissioners, we're seeing beautiful examples of human kindness every day. So don't lose sight of that. Keep positive. Mark, thank you for putting this together.
Thanks, Steve. And I just want to echo that. Yes, we all have sort of said we've been talking about the negative, and yes, there is a light at the end of the tunnel. But the truth is, every moment during the last 10 months, there have been moments of miracles and optimism and passion. And we really are just asking our constituents, asking our neighbors, asking our friends to dig just a little bit deeper into that emotional well to show compassion to one another. This has been devastating for businesses. It's been devastating for folks who have to administer institutions and organizations, and it has been devastating for families. There are still some who question even the very nature of the disease. It is a real disease that is taking real lives. I certainly know that. And moving into this holiday, we just are asking you not to frighten anyone, not to scare anyone, just to simply say that there are basic steps we can take to be safe, be considerate of our health and the health of our friends and the health of our families. So we ask you to keep this holiday small, find ways to celebrate that perhaps wouldn't bring us all together physically. And in doing so, extend to one another the common decency and the common compassion that I know that we have shown these last few months. We know all of us exists within each other and will ultimately help to save lives. So we thank you for participating today. We're grateful that you, those who are watching, would spend some time with us, and please reinforce that message at home. Happy Thanksgiving, everyone.
Thank you.